some of these illegal procedures that you've seen done?
I think the most common procedure we're seeing here in South Florida is the injections of something called Biopolymer. And for some reason, they're calling it a Biopolymer here in South Florida, and it's silicone. You have no idea what you're getting injected. Most of those patients are getting things injected at barber shops or beauty shops or something like that. They tell them, or someone came in from overseas and she has this great product. My friends used it, everything was good, and several girls will go do it because it's cheap. And unfortunately, it results in infection. Exactly.
It's cheap. If it's cheap, and if it's not a physician who's doing it, that should be the first thing that you're looking at. It's not a doctor doing it.
Yeah.
And we run across this constantly.
Constantly.
Isn't it fair to say that a lot of what we see here with a lot of the underground illegal procedures are often those who are sometimes addicted to plastic surgery? They're the ones who seem to, I've got to have it, I see it, my friends have got it, I've got to do it. I mean, that's a real thing. This addiction to plastic surgery is real, yes?
I will tell you, it is, but I'll tell you the truth. There's something called body dysmorphic disorder, where there's patients who pursue multiple interventions. The reality, I think, especially with South Florida, with the connections of Latin America, tend to give us this easiness or facility of having a lot of this illegal, like you say, procedures that are performed by people who are not, authorized providers. They're not trained physicians. They're who knows what. But in reference specifically to the body dysmorphic disorder, these are patients who will be seeking or going from one plastic surgeon to another plastic surgeon to have an intervention. And at the beginning, sometimes it might not be diagnosed. It might present with one intervention, and by the time you see a person that has been jumping from physician to physician, that's how you establish that diagnosis, that there is some type of addiction to these procedures.